Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Heart failure is a life-threatening condition that affects more than 5 million people each year in the U.S. Joining us to talk about this is heart failure and transplant cardiologist, Dr. Rola Khedraki. She is with the Scripps Clinic Medical Group in La Jolla, California. Doctor, thanks so much for being with us.
Thank you, Susan. It's a pleasure.
So what happens when the heart starts to fail?
Yeah, so the term heart failure can sound alarming sometimes for patients, but it really just refers to a condition where the heart is not pumping enough to meet the body's needs.
So it doesn't mean that the heart has completely stopped.
That's right. In this case, the term failure really just refers to a reduced pumping ability of the heart, not a complete failure or a stopping of the heart.
And heart failure is different than a heart attack, correct? What's the difference?
Heart failure is caused by conditions that affect the heart muscle and its pumping ability. When we're talking about a heart attack, we're referring to a sudden blockage of blood flow that's supplying the heart. So that's a medical emergency, and it's really important that that's treated promptly in order to minimize heart muscle damage that can lead to heart failure. Typically, the symptoms of heart failure, again, are going to be fluid buildup, fatigue, shortness of breath, but a heart attack typically will present more sudden onset with things like chest pain.
So who is most at risk for heart failure?
Yeah, so people who have risk factors, certain medical conditions are certainly at higher risk. Patients with high blood pressure, diabetes, coronary artery disease, valve disease. Certainly, heart failure can affect all ages, but as we get older, we become more susceptible to conditions that can damage the heart muscle. And then there's lifestyle factors, things like smoking, excessive alcohol use, diets that are high in processed foods, sedentary lifestyles, chronic stress, and of course there's genetics. So if heart disease runs in your family, you might be at higher risk.
And what are the symptoms of heart failure?
So patients usually present with shortness of breath, fatigue, swelling. This can be swelling in the legs and ankles or the abdomen. And that can also lead sometimes to poor appetite and nausea.
So what causes heart failure?
So it's a variety of causes. Certainly as we become older, we become more prone. Coronary artery disease is a common cause. So these are blockages in the heart vessels that lead to decreased blood flow in the heart. There are lifestyle factors like smoking, excessive alcohol use, poor diet, stress, sedentary lifestyles, and then other conditions that patients have, like high blood pressure, valve disease, diabetes, kidney disease, sleep apnea, thyroid disease. And then there's things like viruses. So coronavirus, influenza, Coxsackie, these can all culminate. So it's a lot of genetics, it's other medical conditions, and it can be environmental factors.
And so how do you diagnose heart failure? What are the tests?
So it really all starts with getting a good medical history and evaluation of the patient's medical background. But one of the most common tests that we'll order is something called an electrocardiogram, which is a test that looks at the heart rate and rhythm. And then we'll order an echocardiogram, which is an ultrasound of the heart that allows us to take pictures of the heart and look at the heart muscle, the valves, the pressures inside of the heart, and make an assessment there.
And what is congestive heart failure?
So it's really just semantics. Oftentimes we use the terms heart failure and congestive heart failure interchangeably, but really congestive heart failure is a stage of heart failure where patients become more prone to fluid buildup and require diuretics in order to prevent that buildup from happening.
So there are different types of heart failure. Explain what is systolic heart failure versus diastolic heart failure.
Yeah, great question. So I'm actually going to use this heart model here. So we actually have two upper chambers of the heart that we call the atria and two lower chambers that we call the ventricles. And the main pumping chamber of the heart is the left ventricle, and that's responsible for pumping blood into the body. And we measure something called the ejection fraction, or EF, with an echocardiogram, which is an ultrasound of the heart. And normally, the ejection fraction, or squeeze of the heart, is around 55 to 60%. So this represents the percentage of blood that is being squeezed out with every beat. So in systolic heart failure, the squeeze of the heart is decreased, and blood is not moving forward as well. And so you can have a backup of blood into the lungs and into the body, including the abdomen and legs. Conversely, in diastolic heart failure, the squeezing ability of the heart is maintained, but the problem is that the heart is not relaxing well. So by way of analogy, the heart should be a very elastic, stretchy balloon that can accommodate blood as you exert yourself. But as it becomes more stiff, again, by way of analogy, you kind of want to imagine it kind of like a glass of water. And when it overflows, it backs up into the lungs and the body. There's actually a third kind of heart failure, something called right-sided heart failure. And this happens when the right side of the heart starts to fail. And that most often happens either because of diseases on the left side getting transmitted over to the right and causing weakness on the right, or high blood pressure in the lungs that cause right-sided heart failure, or valve disease as well.
So how do you treat heart failure?
Great question. So this is an exciting area because we've seen so many advancements in the treatment of heart failure. So really our mainstay for treatment is using a combination of drugs that will attack the heart failure pathway from different angles. And these really work to decrease the workload on the heart, relax the blood vessels, decrease stress hormones that cause heart failure. When the medications are not working well enough, then we start to turn to procedural or surgical-based therapies. And this can include implanting devices like this one, where we can synchronize the electrical activity of the heart. This gets implanted into sort of the upper chest wall with wires that help to synchronize the contraction of the heart muscle. This is appropriate in patients who both sides of their heart are not contracting simultaneously. We have defibrillators that will deliver a shock to patients who are at risk for life-threatening arrhythmias. And in some cases, we offer surgeries to fix heart valves and heart arteries. And fortunately, nowadays, we have so many minimally invasive techniques to deliver heart valves or stents to open blocked arteries. And in severe cases, in patients with really advanced heart failure, we can even use pumps like this one, something called a left ventricular assist device, or an LVAD. And this essentially gets plugged into the left ventricle of the heart surgically and helps to pump blood into the body. And in some cases, we can also use heart transplant as a method of treating patients.
Can heart failure be reversed?
So generally speaking, it's considered a chronic condition, and it really depends on what the underlying cause is and the stage that it's diagnosed at and how well it's managed. But certainly if there's a reversible condition that's causing the heart failure, like a blocked artery of the heart, an abnormal heart rhythm, a valve problem, then patients can live pretty normal lives once that underlying issue is treated and managed.
And how long can you live with heart failure?
So it's really a spectrum. It's going to vary widely depending on each individual patient. Some patients have very mild heart failure and some have very advanced disease. So it just depends on how severe it is, the underlying cause, the patient's response to treatment, and their overall health. One of the biggest predictors of life expectancy is how often people are having to get admitted into the hospital for heart failure. And so our treatments are really aimed at keeping patients out of the hospital in order to extend their life and improve their quality of life.
Is there anything that you can do to prevent heart failure?
Absolutely. Prevention really involves managing risk factors like high blood pressure, diabetes, really adopting a healthy lifestyle that limits processed foods, exercising regularly, avoiding excess alcohol, managing stress, and having good quality sleep. And that also means treating sleep disorders like sleep apnea. And I think just having regular checkups with your doctor so that when problems arise, they can be caught early.
What is the most important piece of advice that you would give to someone who is concerned about heart failure?
I would say just taking proactive steps to manage your health as early as possible. You want to know your risk factors, things like high blood pressure, diabetes, obesity, smoking. And if you have any of those risk factors, you really want to take them seriously. You want to see your doctor and work with your medical team in order to address those. And I think just listening to your body, paying attention when you have symptoms like shortness of breath, chest discomfort, and seeking medical attention immediately.
Any final thoughts, doctor?
I would say ask questions, know your treatment options. You're not alone in this journey. Reach out to your care team, support groups, and just focus on what you can do to improve your health, stay positive, stay informed, and we are here to help you.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you so much, Susan.
If you want more information on heart failure, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.